Hello everyone, this is Manjot Kaur. Today I'm going to present my gap analysis presentation. Here I would like to describe one of the known healthcare issue in Canada. One of my friend lives in Canada from 8 years. From few years he moved to a remote area for some reasons. He got some injury in his spinal cord and when went to hospital did not get treated at time. There was a long waiting period that he could not have a meeting with the specialist in his three turns. He had severe pain. The reason was the staff shortage at the hospital. Moreover, it was COVID-19 pandemic period. The staff that was working there seemed like stressed and pressurized to him. Not only him, I came across many people who told me their same painful stories. The current situation. The shortage of healthcare staff is particularly acute in rural and remote areas of Canada. A report from the Canadian Institute for Health Information found that nearly 20% of Canadians live in rural or remote areas, but only 10% of physicians and 3% of nurses practice in these areas. This shortage of healthcare staff can result in longer wait times for medical appointments and procedures, reduced access to care, and poorer health outcomes for residents of these areas. The COVID-19 pandemic has put significant strain on the healthcare system, with many healthcare professionals working long hours and experiencing burnout. The shortage of healthcare staff has also made it difficult to respond to the pandemic effectively, particularly in areas where the number of cases is high. The future. Addressing the shortage of healthcare staff in Canada through improved training, education, compensation, and other measures would have positive impact on both the healthcare system and the population as a whole. By addressing the shortage of healthcare professionals, the preferred state of healthcare system would be better equipped to provide timely and high quality care to patients. This could help to improve patient outcomes, reduce wait time, ensure that individuals have access to care they need, reduction in staff turnover rate, and ensure that positions are not left unfilled. The gap. The gap between the future strategies for addressing healthcare staff shortage in Canada and the current situation is quite significant. Currently, Canada is experiencing a shortage of healthcare workers, particularly in rural and remote areas, which is impacting access to healthcare services for Canadians. Some of the current challenges and gaps include aging healthcare workforce, insufficient training capacity, recruitment and retention challenges, uneven distribution of healthcare workers, and limited access to technology. There are three practices recommended to address healthcare staff shortage in Canada. Practice number one, investing in healthcare education and training, a pathway to improve patient care and health outcomes. The government should focus on the need for greater investment in nursing education and leadership development. This pathway will provide valuable insights and recommendations on the challenges facing healthcare professionals, particularly nurses, in Canada and offer evidence based strategies for addressing issues related to workforce shortages, workplace stress, education, and leadership development. It will evaluate the potential impact of various policy and programmatic interventions aimed at addressing the challenges of healthcare staff shortage. There is a limitation of funding and resource constraints to make this practice effective. Practice 2, culture of support, improving working conditions and compensation for healthcare professionals. This practice will be acquired by providing adequate staffing levels, increasing pay and benefits, and addressing issues of burnout and mental health. The creation of supportive culture and compensation programs will provide focus on leadership roles, the need to prioritize staff well being, the need for targeted intervention to address burnout and promote mental health. It could serve as a useful starting point for policymakers and healthcare leaders looking to improve the working conditions and compensation of healthcare professionals in Canada. While the proposed solutions are promising, it remains to be seen how effectively they will be implemented in practice, because it is much more difficult work to build and sustain a meaningful, responsive, well resourced, and well managed role for healthcare workers. Practice 3, improving access to care and enhancing patient outcomes through expanded scope of practice for healthcare professionals. The expanded scope will enhance the clinical abilities of pharmacists or any other healthcare professional early in their careers to prepare them for work in primary care. The approach will improve consultation skills, uptake of patient centered approaches, and leadership skills in healthcare professionals. This learning shows great potential to be applied to other healthcare systems under pressure. However, implementation of such programs requires buy into a shared vision across stakeholders, and an honest appraisal of the support that learners need. Financial considerations, time and space constraints, lack of patient acceptance, and challenging collaboration with other health providers. There are three future recommendations to address healthcare staff shortage in Canada. Canada's federal and provincial government should invest in healthcare education and training, which is considered as a pathway to improve patient care and health outcomes. Creating a culture of support, improving working conditions and compensation for healthcare professionals, improving access to care and enhancing patient outcomes through expanded scope of practice for healthcare professionals. From my perspective, I would recommend that investing in healthcare education and training is a key strategy for closing the gap between the current healthcare staff shortage in Canada and the future strategies for addressing this issue. By investing in education and training, Canada can increase the number of healthcare professionals entering the workforce, improving the skills of current healthcare workers, and ensure that all Canadians have access to high quality healthcare services. Some ways in which investment in healthcare education and training can help close the gap include increasing training capacity. Investing in healthcare education and training can help increase the capacity of healthcare training programs, allowing more students to enter the workforce more quickly. This can involve expanding existing programs, creating new programs, and providing funding for students to pursue healthcare careers. Improving the quality of training, encouraging specialization, supporting healthcare workers in rural and remote areas, and leveraging technology. Now, the success of training and education programs require clear goals and objectives, collaboration and partnerships, adequate funding, evidence-based approaches, continuous evaluation and improvement. But will these programs be effective? And how can I achieve this? The key elements can be selected as follows. Recruitment, measurement of the number of healthcare staff hired through the investment in training and education programs. This will help determine if the program is successful in attracting more healthcare staff to the industry. Retention, monitoring the retention rates of the healthcare staff who have completed the education and training programs. This will help assess if the program is effective in retaining healthcare staff in the long term. Performance, measuring the performance of healthcare staff who have undergone the education and training programs. This can be done through performance evaluations and assessments, feedback from supervisors and colleagues, and patient satisfaction surveys. Cost, monitor the cost effectiveness of the investment in training and education programs. This will help determine if the benefits of the program justify the cost. Feedback, collecting feedback from healthcare staff who have undergone the education and training programs. This will provide insight into the effectiveness of the program and areas for improvement. Monitoring key elements, setting specific goals and targets for each key element, regularly collecting and analyzing data, comparing the data, using the data to identify areas of success and areas for improvement, adjusting the program as needed based on the data collected to ensure the program is effective in addressing the healthcare staff shortage in Canada. And at the end, collecting feedback from healthcare staff, supervisors, and patients regularly to ensure the program is meeting their needs and addressing the healthcare staff shortage in Canada. The investment in training and education programs is a significant method to address staff shortage because there are a lot of individuals who do not have access to healthcare programs. But this approach is time consuming and expensive. The resources may be limited. The new training programs or educational approaches can be met with resistance from some healthcare professionals or organizations. Measuring outcomes can be challenging, and it will be difficult for healthcare education and training programs to keep up with the changes of constantly evolving healthcare landscape, new technologies and approaches, and ensure that healthcare professionals are equipped with the latest knowledge and skills. The implementation of such programs would require the transformational servant leadership competencies of conceptualization and foresight, which will help understand the system, the future perspectives. Under the LEADS framework, the investment in such programs require building relationships with stakeholders and systems transformation to ensure that more and more healthcare workers who can be existing professionals, new trainers, or immigrants become able to perform at frontline, resulting in increased timely patient care. Thank you.